Every day, I'm seeing 2 or 3 new teenagers with mental health concerns.
More young people in Alberta are dealing with mental health issues, and what's to blame? The pandemic.
With COVID, with the isolation, away from their peers, away from their means of releasing their stress, sports, activities, what have you, but also fear of getting sick. To look at all of this additional stress on kids that previously were doing well, it's just really snowballed.
In a survey by the Alberta Medical Association, 77% of parents reported the mental health of their child aged 15 and older is worse compared to pre-COVID-19.
The number of kids I've seen in the emergency room in that state of crisis this year alone is far greater than I've ever experienced in 23 years of working in a rural emergency department.
The Alberta's government announced its Child and Youth Wellbeing Action Plan this week, allocating $113 million to provide targeted supports for students experiencing both academic and mental health challenges.
I am very glad that they announced the funding that they did and recognize the urgency to get this out there.
The province's plan includes expanding of mental health and behavioral supports in schools, but Dr. Warren says more work has to be done, including providing better accessibility to pediatric psychiatrists.
I think virtual mental health will be one way of doing this, because through COVID, that's, I think, been one of the takeaways, is that we can actually use technology to reach people where they're at and to be more effective. It is an area that we're working with government moving forward.
In Edmonton, Heba Kamal Shufi, City News.
Look at